Vanakkam. Welcome to this course on classics in neuroscience. We have been looking at the development of neurosurgery as a discipline on its own. We looked at the background and the origins of neurosurgery as a discipline, and then we looked at the seminal contributions of Harvey Cushing to help develop the field of neurosurgery as a discipline. In this video, we will look at pituitary surgery and how development of methods and techniques to treat pituitary body and pathologies in the pituitary body led to the development of this field of neurosurgery, and how the visualization of human brain evolved over a period of several decades from early 1900s to 1950s or maybe even 1970s. So, till late 19th century, that is about 1890s, the pituitary body was practically considered a vestigial structure with no, or at least it was not clear what the specific function was at that time. But pituitary tumor was a relatively not so uncommon problem that presented itself. Perhaps the first recorded surgical operation to remove pituitary tumor was performed by none other than Victor Horsley in 1886 at Queen Square in London. So, in the good old days, the method was a transcranial approach, making an incision through the skull. This has the danger of making cuts through several layers of tissue, and so that means that there is a greater amount of possible trauma. In 1912, an approach was developed by Oscar Hirsch. This approach came to be called as the transsphenoidal approach, whereby the incision was made through the nose directly to the pituitary body, thus minimizing the amount of trauma or incision that is made along the brain. So, it is a critical insight, a critical procedural change made by Oscar Hirsch in Vienna. Later it was realized that the pituitary gland is perhaps the master control center for the endocrine system. We discussed the important consequences of the field of neuroendocrinology for behavioral neuroscience and many other disciplines, many other fields. As in 1912, Cushing operated on a patient, a lady who had obesity, hairiness, overdeveloped secondary sexual characteristics, and he found that there was primary adrenal tumors or adrenal hyperplasia secondary to stimulation by pituitary tumors. He actually operated on several such patients, so much that his description of this disease led to this disease being named as the Cushing disease. Like you have Parkinson's disease, named after the person who first properly described this disease. Likewise, this disease came to be called as the Cushing disease. He first started using a transcranial approach for his surgery. Later, he switched to Hirsch's approach, and then I think he switched back to the transcranial approach, which was a favored technique from the 1950s. Throughout these times, there was an increased need to understand brain physiology, not just brain anatomy, but also brain physiology. This required a visualization of the human brain, a map of the human brain was required. This line of work was started as early as 1870s, or 1860s and 1870s from the work of Broca, Wernicke, Fritz and Hitzig, David Ferrier in England and others, especially the work of Richard Hitzig and David Ferrier, exploring the function of cortex through stimulation, providing the areas that are involved in motor control, areas that are involved in movement generation. But such stimulation will not provide any insight into the association areas, into the executive decision making areas, or into the sensory areas, or areas of the higher mental functions. What are these? Essentially the executive decision making, the prefrontal cortex for example. Such stimulation will not provide an insight into the sensory or association areas or the higher mental function areas. The other main method was of course ablation. Ablation essentially involves removal of specific sets of tissues. This helped identify the regions that were critical, that played a causal role in senses of vision, hearing, touch and so on. Yes. By early 20th centuries, another method helped identify and map out the brain areas and pathways. That method was through anatomy. But what do we mean by anatomy here? Essentially, I suppose this means cytoarchitectonic methods. What is this? That is histology. Using histology and identifying different types of cells within the brain, it is assumed that different types of cells or cells that have different types of architectures necessarily perform different functions. That is the assumption. So, those that perform similar function look similar under the microscope. So, these are the types of work that was pursued by histologists, starting with the works of Golgi, Santiago Ramon y Cajal, later well developed by scientists such as Corbinian, Brodmann and Alfred Campbell and others. Perhaps these main areas and pathways were identified by the seminal contributions and seminal works of Brodmann and Campbell, for example. Of course, ablation is a very crude tool. We discussed about ablation, removal of tissues, but it can be an extraordinarily crude tool that sometimes it is possible for surgeons to destroy regions of the brain that are necessary and critical for normal function. For example, look at what happened to patient HM. Because there was resection of bilateral temporal lobe in patient HM, what happened was a peculiar case of an extraordinary memory loss. Of course, this gave rise to the many studies and insights into the processes of memory, but this is a great danger involved with ablation, something to keep in mind. Also, there was a recognition for the necessity to identify specific landmarks within the brain. So, you need to identify the landmarks in the brain by using topographical landmarks by the presence of gyrus and sulci. Gyri and sulci. What is gyrus? The bumps, these bumps. And the folds are called as sulcus or sulci. There are these well known and well marked gyri and sulci, for example, the precentral gyrus, or the well known sulcus is the central sulcus that divides the parietal lobe from the frontal lobe. Also remember, we have discussed the region of the brain that is just anterior to the central sulcus was identified as the region responsible for motor control, but that required identification of the central sulcus as an important topographical landmark, is it not? So, the central sulcus was prominent, but it varies across individuals. So, you can't, it is not immediately obvious, it requires some experience to be able to identify. Yes. Of course, other techniques were used. X-rays were used to visualize deep structures through contrast agents, through air or contrast encephalography. This method was popularized by one of the students of Cushing, or one of the trainees of Cushing, Walter Dandy, in 1918. And another method was pneumoencephalography, which was used to localize brain pathology, but there was some risk associated with it because it contained the possibility of having mortality as high as 10%. In the good old days, this was not so high, but by today's standards considered still very high. And of course, there was the possibility of using cerebral angiography. This technique was developed by Antonio de Egas Moniz and Pedro Almeida Lima in 1927, who used via X-ray to visualize after a contrast agent was injected via the carotid artery. Important is the use of carotid artery for this purpose, because if you use the carotid artery, there is an increased risk of embolism in the brain. So, this was used as a method to visualize the brain, but still it carried with it some risks. In 1953, an improved angiography method that was much safer was developed by Sven Seldinger. He suggested that the contrast agent can be injected into the femoral artery, and this essentially became the standard method after that. This essentially started the field of neuroradiology as a subspecialty of neurology, neuroscience and neurosurgery, for example. Of course, in the 1970s, brain imaging was developed well enough that helped overcome the high mortality problem associated with pneumoencephalography and the lack of effectiveness of identifying deep brain structures using cerebral angiography. So, there are some disadvantages with this method, but to overcome that you need to have waited until the 1970s for the development of brain imaging. Remember, we discussed in the previous set of videos the development of brain imaging or neuroimaging as a field in itself, and how the identification of the amounts of oxygen and carbon dioxide going in and going out of the brain were critical in helping to identify brain function. So, this somehow later helped develop the field of brain imaging. We have discussed this in the previous set of videos. So, with this we come to the end of this video. In this video we looked at pituitary surgery and how initially transcranial approach to remove pituitary tumors were used, and later incision along the nose at the level of the nose was used to reduce the amount of trauma. And we also looked at the various methods that were adopted to visualize the human brain. With this we come to the end of this video. Thank you for your attention.